why wouldn't we expect digital health professionals to have the same level of scrutiny and the same level of professional identity as well? Because after all, they're looking after one of the most valuable things around at the moment, which is patient data.
Hello and welcome to Pulse Amplify, where we sit down with the leaders and change makers shaping the future of health. Proudly brought to you by Pulse IT News. I'm your host, Louise Schaefer.
And I'm your other host, George Margellis.
Now, regular listeners to the pod know that workforce is a topic we return to again and again on this show. Well, earlier this year, something happened in the UK that I think is genuinely historic for our field. And we covered it on Hot Topics. NHS England has confirmed a phased expectation that its digital data and technology workforce will hold professional membership and registration, putting DDAT, as they call them in the UK, digital data and technology roles, on the same footing as other established NHS professions. And our guest today has been at the centre of making that happen. Jane Dwelly is Vice President International at CHIME, the College of Healthcare Information Management Executives, where she leads the professional education and accreditation programs that have shaped an entire generation of CIOs, CNIOs and clinical digital health leaders across the UK, Europe and the Middle East. And last October, Jane was appointed Chair of FedIP, the body that maintains the UK's public register for health and care informatics professionals, and they bring together 6 professional bodies under one set of standards. Now, Jane's journey is a unique one. She didn't come up through clinical or IT, as many of us do. She actually began her career as a financial journalist at Bloomberg and then spent 16 years inside UK health policy, including stints as Chief Press Officer at the Department of Health, Communications Lead for Lord Darcy's NHS Next Stage Review, and was also a Deputy Director at NHS England. So now, with that history, and that's a potted history, but we now have the person leading the professionalisation of the digital workforce being someone who really understands deeply that professions, they're not built by technology, they're built by identity, standards, narrative and belonging. Jane, it is fantastic to have you in the studio. Welcome to Pulse Amplify.
Thank you, Louise and George. Great to be here.
It is great to have you on board.
All right, Jane. Now, it seems everyone on the planet is aware that healthcare has a workforce supply problem. But here on Pulse, we're specifically concerned with workforce capability and capacity around digital data and innovation. So why do you think these topics are becoming such a strategic focus now?
I think it's a really interesting question, and it is one that draws upon the history of digital in all healthcare organisations around the world, which is that for the last 20 years, it's become something that was an ancillary product that supported change and strategy to something that is actually leading those strategies and those changes. So it's completely shifted its perspective. And I think we saw that happening a lot in healthcare policy here in the UK when we went from trying to force everybody into using one system, and that was the famous or rather infamous National Programme for IT, the NP-FIT programme, which was ultimately cancelled, into recognising that you can't do that and that the human element in digital is so powerful that we have to let the workforce lead the way. And that is why digital is becoming such a motivating force in healthcare. And at CHIME, we talk about digital health the whole time. And I like to say one day we'll stop saying digital health and just say health, because all health will be digitally enabled.
Yes, we will get there.
I am looking forward to that day where I'm no longer called a digital health person, but just a health person. I think my medical degree requires some respect in that regards, but the reality is that digital capability is a fundamental skill. If you don't know how to use the technology, you really can't deliver care to the same caliber and quality as other providers. So is digital capability becoming as fundamental as clinical capability?
I think so. Of course, I would say that. But I also have seen with my own eyes how important it is for hospitals to have those very strong clinical and operational digital teams leading that change. And every clinician working with them needs to have that digital confidence. And that's where we're really seeing the missing link at the moment, particularly in the NHS. So we have lots and lots of very skilled clinicians who still don't think digital is their business or their concern. And they might use it every day in their clinical practice, but they're not investing any of their time or energy, probably because they're so busy clinically, but they're not seeing the link between what they're doing with their patients and how they use digital health and actually how that's going to support their practice going forward. And so what that ends up being is a leadership question. Where are the leaders in these hospitals and other organisations, and actually right at the top of the organisation in NHS England and soon to be in the Department of Health and Social Care? Where are those leaders who are saying it's absolutely critical, it's mission critical that we have this strong focus on digital? Now, you might remember that a year ago we had the publication of the 10-year plan for the NHS, and it had three main pillars in it, and one of them was the move from analogue to digital. The other two were hospitals to community and from prevention to cure. So the three pillars together work really well, but the strongest one, and the one that's most likely to happen first, in my opinion, is the move from analogue to digital. And for that, we need very strong leadership. We need the DDAP workforce, which incidentally numbers over 40,000 people in the NHS in England alone. We need those people to be involved. We need them to understand how to support clinicians to become true digital health workers and use that knowledge and the data they're continually collecting, use that to make sure it's something that can actually be turned around and used to improve patient care fundamentally.
Yeah, absolutely. And those other two pillars need digital professionals as well, and need the entire clinical workforce to have some level of digital capability.
And also, as every clinician understands things like infection control and how to manage the patient's journey, every healthcare professional now needs to have a similar level of digital capability wherever you're working in the hospital. And there's really no excuse. And that's where we're sitting at the moment at CHIME and at FedIP in terms of opening people's eyes to this new professional need.
Absolutely. So at Rewired in March, NHS England confirmed the phased expectation of professional membership and FedIP registration for this workforce by March 2027. And I believe that's for the senior leaders, and then it's going to extend across the workforce down to 2031. So for our listeners who don't think about these issues constantly, as George and I and you do, Jane, why is professional registration such a significant milestone, and what's the problem that it's actually solving?
I think every profession in healthcare has standards, and we see that with clinicians, obviously. We expect them to maintain their registration. We expect them to join a medical Royal College and be seen to be fit for practice and almost hand their professional development over to that college. And we've seen very clear benefits across the years of clinicians doing that. We also expect operational staff like HR professionals and those working in estates or legal to have the appropriate registration and professional skills that are recognised and also constantly updated. We expect our lawyers to adhere to professional codes. And so why wouldn't we expect digital health professionals to have the same level of scrutiny and the same level of professional identity as well? Because after all, they're looking after one of the most valuable things around at the moment, which is patient data. And if that gets into the wrong hands, or if that's stolen, or if a hospital's taken down by a cybersecurity incident, that is very serious. So that recognition has been growing for a number of years. And it started by NHS England about 10 years ago, asking all the professional bodies to come into this federation, the Federation of Informatics Professionals working in health and care that we call FedIP. And that was a really smart thing of NHS England to do because the landscape was really confusing. There were lots of little bodies all working away, dealing with small numbers of people with their specialisms. So we have and had a professional body for analysts, one for librarians, one for working in social care. And then we have people like the British Computer Society and CHIME working more holistically across the whole tier of healthcare, digital healthcare leaders and the profession. So somehow we thought this is right. And then we talked about introducing standards. So if we're going to federate and we're going to bring all these people together, the next thing we need to do is introduce standards. And that's what we've been working on at FedIP for the last number of years. And as well as introducing those standards, we've talked a lot about job architecture and how people can understand their role. Because the other thing that was lacking, actually is still lacking, is recognition from the centre about the specific skills a digital health professional needs, clinical and operational. Well, we have those skills written down and codified by our Agenda for Change structure, which is so important to the NHS and guides professionals throughout their career. We don't have digital skills in Agenda for Change yet. And so it was really important that FedIP set about defining those standards and helping people understand where on this level of standards they are. So the next thing we did was introduce a public register, because that's really important, isn't it? That people understand if they are going to stand up and say, I'm a digital health professional, they need to also say, and I'm publicly recognised for that. So by joining a professional body such as CHIME or one of the other 5, they can then join the public register at one of 6 standards. And that's a really important thing. So you can see at what standard somebody is working at. And that helps them as well plan their career moves, plan their professional development. And so we're very, very keen to stress that working in digital health is a proper profession with standards, with a public register, with that public scrutiny that you'd expect people to have as if you were a doctor or a nurse or another healthcare professional. And so when NHS England said to us about 18 months ago now that they were going to change the way in which they operated with FedIP, we said, okay, that's fine, but you need to mandate the professional registration of digital health professionals. Now, we didn't get as far as a mandate. We got as far as a recognition or a suggestion or a recommendation. And I think everybody in FedIP hopes that one day that registration will be compulsory, will be mandated. But you know what that's like. That's a big step to take. So we're happy to go with the preferred approach now. But we hope that as the register grows and more people come onto it, we will have that strength in numbers that really calls for a mandate.
And so without the mandate, does it actually have teeth? Because there's no pushback if someone decides not to do it, right?
No, there isn't. But it's really about accountability, competence, and also demonstrating public trust. So if you are responsible for systems that clinicians rely on every single minute of their working day, then you need to be someone who is qualified to do that. And so, yes, you can operate without being on the FedIP register at the moment, but there is a growing recognition that you should be there. And the structure that NHS England's put in place with this recommendation about professional registration and the support it's given FedIP to do that, really, there's no excuse for not being on the register. And I have seen lately job adverts describing FedIP registration as an essential or preferred competency that people are looking for. And I give a little cheer every time I see that, because it's important. If you are out there working as a CIO or a CCIO or a CNIO, anyone in a digital health leadership role, you should be on the register as an advanced practitioner.
Yeah, I love that. I remember not long after we launched the certification program in Australia, one of my staff going, "You're going to love this story." A guy rang up and wanted to know about how he could become a chair and what was involved. But the reason for the phone call was he applied for a job, and when he didn't get the job and asked for feedback, they said, "We've given it to someone who's actually certified professional."
It gives employers confidence, doesn't it? They are employing somebody who knows what they're doing, so that before people even start in these digital health jobs, they need to have a baseline of training where they understand what they're doing, and they're not going to lose patient data, have a cybersecurity incident on their watch, or many other things that are happening. And we haven't even talked about AI yet, which is, of course, our new challenge in all of this space.
Time for a quick break, and when we return, more with Jane Dwelly on the efforts the UK are taking to professionalise and recognise the digital health workforce and building the pipeline. We also are going to talk about the impact of AI on the workforce and whether there is a role for an international standard for digital health professionals where we can all move around the world and get jobs everywhere and be recognised for our prior skills and learning. More on that soon.
There are some heartening things there. For example, the fact that it's starting to turn up on job applications as a requirement, and from a young person coming through the ranks, knowing there's a structured way in. Because one of the challenges we've had with the digital health workforce up till now has been there really is no structured process of coming in. It's very ad hoc. When some of the older ones get together, we compare war stories of how we got into the game, and it's often very convoluted. So I think that's really exciting, and it's a process. It's not an overnight process. So Registration means signing a code of conduct, evidencing your skills against an occupational architecture, understanding what the roles actually require. And in the past, many CCIO roles have dynamically evolved depending on the person rather than the job required of them. And 10 hours of CPD a year, no exam, real world experience is credited, that's great. But for the clinical professions, registration ultimately comes with consequences. You can be struck off. The biggest threat we have as a medical practitioner is that you'll lose your registration. Are digital roles really that critical that they need to have that same sort of fitness to practice proceedings? What sort of governance model are we looking at of that career path?
It's a really good question, and it's one I'm often asked as chair of FedIP is, will this lead to people being struck off the register? And we don't currently have a process in place for that. We're at the beginning of this journey, and it's about supporting professionalism, not punishing people. And we hope that people have the ability to understand how to work that register correctly. So you do have to reapply every year to be on the register through your professional body. And that's the critical thing. The onus on putting people on the register sits with the professional body. And I have to say, looking at my colleagues on the FedIP management board, they're very strict in terms of defending their professional body and the people that join it. And so I'm confident we have got a system in place. It's not infallible, but fundamentally registration currently is about raising standards. It's about putting digital healthcare leadership right at the centre of all decisions in the hospital, and hopefully over time helping that governance mature as those professions develop. I mentioned already that the FedIP represents lots of different professions within the digital health scope. CHIME focuses entirely on leadership. So we talk a lot about how to lead this change, how to lead this cultural and strategic change that's necessary to take people forward. And fundamentally, it's a people game, isn't it? Not a technology game. You could have the best kit in the world, but if people aren't going to go along with the strategy and the transformation, then you might as well have just kept it in the box. So professional recognition gives digital leaders the same status, standards and identity as other healthcare professions. That's what we're really working towards, that status of being a registered digital health professional. And hopefully with that will come people understanding the responsibilities of holding that recognition.
And Jane, this is an issue that's global. Can you tell us what was the ingredient that finally shifted the expectation in the UK? Because I know you and many of the others who have been working on this for a long time, and we've got a very successful certification program here in Australia, but Australia doesn't yet have a national employer with an expectation. It's still more piecemeal, really. So what was the ingredient? How did you make that happen? How can the rest of us do the same?
It's taken a minute, absolutely. It's taken 10 years and we're still not exactly there. I think there were pressures from the top in terms of a workforce plan that's been in the making for a number of years, and we still actually haven't seen it at the moment. So that was the first thing. So the workforce plan became something that was driving that desire to have people registered. The 10-year plan I mentioned, that also shone the light on the move from analog to digital. But I think the real thing was the long-term collaboration between professional bodies and the occupational architecture that I mentioned. We spent many hours mapping the architecture of people working in digital health roles, and that provides the evidence we need that this is a serious situation in terms of professionalism and leadership across digital health. I think also COVID, as discussed ad infinitum now, accelerated that digital conversion and adoption. But more recently, AI has changed the conversation as well. And suddenly we're dealing with a whole new set of challenges to digital professionalism. So it's a huge opportunity, but it also comes with risks that people are acutely aware of. And managing that and being people in charge of that has been a real driver towards this professionalism. But I would say as well, people like Andrew Griffiths, the chief exec of FedIP, who has driven this agenda for many years, and people on the board and people on the professional bodies who really believe in this are people who've really made this happen.
So Well, we look along this for leadership roles, but the reality is those digital capabilities are now required throughout the whole sector. What are your thoughts around the same sort of certification process for people in lower levels, and what efforts being developed to develop a pipeline so that people can work their way up to the level of leaders with these roles?
Yeah, it's a great question. And I'm happy to say that NHS England's plan is for all people working in digital data technology roles to be on the register eventually. And that's right down to people working entry-level jobs and people coming into their first job. So what they've done is they've started with the leadership level. And as Louise said, hopefully by the middle of next year, all those leaders will be on the register. Then we move to the managerial level. And then finally, in the next 2 years, we move to people who are just starting out. And what NHS England has done very cleverly, in my opinion, is while the cost of joining a professional body is down to the professional bodies themselves for those first 2 tiers, and we can set the price ourselves, and we do, NHS England has mandated that anyone grade 7 and below, and that's a junior person, is £50 a year. So the professional bodies across the board have to charge the same amount for the lower grades. And I don't mean that in a pejorative term at all, but those people who are just joining the profession. And that's really important because the cost can be off-putting to people. If you're asking people to part with £150 a year or more for their professional registration over their career, that does add up. So it's on the professional bodies to start making themselves a really good bet and to make that spend a really great value for that individual. So we are working on that at CHIME, and the other professional bodies are too. What is the value proposition? If you choose CHIME, what do you get for your money, as well as professional registration? And that's the big question. So it's forcing all the professional bodies to really think about their offer. But I'm really happy that they have said that the majority of people joining the register, and that is the majority of people, band 7 and below, will be paying £50. So there's really very little in the way of people joining. And if they're serious about their digital profession, they will pay that money and join.
Now, Jane, you've mentioned AI, and I knew we would get to it eventually. So here's your AI question. I know you've been chomping at the bit. You work across numerous countries, even though you're based in the UK. But what are you seeing and hearing about how AI is changing the skills that the workforce need and the expectations around it?
Yeah, it's the hot topic, isn't it? Everyone's discussing it at the moment. And recently, in other conferences I've been to, AI is obviously the main topic of conversation. I firmly believe that AI will not put people out of work. It will change the dynamics of what we expect people to do in digital health roles, and it changes the demand of those roles. So we talk a lot about critical thinking, how you actually use AI correctly. And learning that skill is going to be key to people working in digital health roles and using AI correctly. It also affects things like clinical judgment and change management and data governance and ethics. There's a whole list of things that AI is fundamentally changing. And so people need those skills. So people are concerned that AI is going to take our jobs. It won't. It will just change what skilled people do. So the skilled people remain, the skills they're working with will change. That's my belief. And I don't see any way in which we can reduce the number of people working in health and care. We don't have enough as it is, but they need to reskill and be clever about AI and also use their human judgment more. I think particularly in clinical roles, particularly when you're dealing with individuals and people in front of you with healthcare conditions who are scared and frightened and need your help, we need to make sure that our human judgment is handling that AI correctly and for good. So there's a huge skill update needed there. Do you agree with me on that one? What do you think?
Absolutely. Just this morning, we're having a similar discussion. Obviously, the governance models around these new AIs are critical, and having the right people in leadership roles to understand both the technology behind it, the implications of it, legal ramifications, clinical ramifications. And we've seen chief health AI officers starting to pop up in new roles. Do you see a parallel pathway for not just digital skills and AI skills? And whilst the two are closely related, there are a lot of non-digital skills that are relevant to AI that need to be understood as well.
Yeah, I think it's all down to the digital workforce. It's how strong the digital workforce is, how hospitals can get the best people to come and work for them. I think the next decade won't be defined by AI as such, by who buys the best AI, but who has the best digital workforce to deliver that. I really believe in that strongly, because there's so much that we can do with our human brains and not give over to AI that is so important. The idea that it's going to remove people from jobs, take people out of the workforce is wrong. It might take some people out of the workforce who aren't prepared to develop those new skills, but leadership is going to all be about a clear-sighted look at what we need to make that workforce the strongest it can be, and how they use AI to support them, whatever role they're doing. And returning to that critical thinking point I made, and that's become one thing that we teach at all of our CHIME educations now, is don't be afraid of it, but understand how it can support the work you've done, the work you've trained to do, and ultimately the person in front of you who you're helping.
That's very heartening. I was at a talk earlier today where they were looking at the future AI strategy. And yet a lot of people are fearful of the job loss, but the reality is that the opportunity, how we utilize AI, is the way we're going to get those efficiency gains and productivity gains that we all talk about. We all hear about these potential gains, but it needs people to implement those changes to make it happen. So that's really good news.
Now, Jane, you work across dozens of countries. In Australia, we have a really heavy focus on digital infrastructure, standards, national platforms. Workforces are part of our national digital health strategies, but there's a big difference between where Australia is at right now and the UK in terms of that emphasis on professional recognition of the workforce. So I think there's so many lessons that Australia and the UK, as well as other countries, could learn from. So I'm interested, because I remember we talked about this many years ago. Do you still think that there is a role for an international standard for digital health professionals? We know that there is a lot of movement in especially the clinical workforce globally. And so having an international standard where there was country to country recognition of prior skills and learning, I still personally think that there's a role for that.
There's absolute value in looking at that. And I think as AI makes the world smaller in some ways in terms of how we understand what's going on, that need to have a internationally recognized standard is so important. Health challenges also are global, and the pandemic, though it's disappearing in our memory now, there'll be another pandemic, there'll be another global health emergency, which will bring it back into sharp focus that the challenges we're facing across all spectrum of health are global. AI is global. Cybersecurity is global. Workforce shortages are critically global. People are talking all the time about we don't have enough nurses, we don't have enough doctors to support our population going forward in this century and the next. And so what we need to do is learn from each other, understand how different common competencies look and how they can be understood and recognised, and how we can draw on those to develop an international standard. I think fundamentally the challenges are all the same. I have the luxury and great good fortune to travel and meet people in different countries and spend time in hospitals around the world as a visitor. And you can see the same themes appearing all the time, even in very digitally mature hospitals or ones that have been built from the ground up to be digital. The same challenges emerge, and they are challenges of leading people and developing the workforce. And so that digital standard is going to be critical in supporting people across the different pieces. And enabling people to move around as well. People can travel and share their experiences and work in different countries. That's only going to help that global workforce of digital health professionals who understand the benefits of digital and how it can support people to really deliver care better. And also, we haven't mentioned productivity. The cost of healthcare is something that is critical and will undermine our efforts to bring in the benefits of AI and bring in the benefits of digital health. And so working on ways in which we can make healthcare affordable and move from an illness to a wellness service, from cure to prevention, that's really important as well.
I think that last point in particular is great, in that the right skill set with the right people will enable us to actually look at new models of care. We can't stick to the current models of care. Whilst they've done a great job in improving longevity with the challenges with the health span, we've seen the challenges with supply and demand. I think having a global workforce who can literally work anywhere and support anyone would be a great way forward. So I look forward to that.
Yeah.
And I look forward to coming to the next Global Digital Health Professional Conference.
Oh, please do. We do have many of them. If you are in the UK, we'd love you to come to one of our CXO summits in Cambridge. They've been a success story for us. We set them up 4 years ago. Real, if you build it, they will come moment. And it's slightly terrifying to do it because at first people didn't know what we were doing, but now they sell themselves and we are waitlisting for the next one at the moment. So it's been a really nice thing to do and people love them.
Jane, we have a global audience. So the CXO Summit and your clinical leaders, they're open to a global audience, aren't they? They're not just for people based in the UK.
It's very organisationally neutral, I like to say. It's not all about the NHS, it's all about leadership. And leadership is a global concept. So we have people travelling from all over the world to join us on these CXO summits. And we also run them in other countries as well. But as I said, it's all about culture, the people, the strategy, the leadership, the communication. It's not what people expect. When they come on these courses, they really start to understand how they individually and in leading their team can make that difference, make that change happen.
And to be able to learn from and network with other people who have similar leadership positions and working in other jurisdictions, it's not just the course content, it's also who you get to network with and meet and learn from. So yes, when is your next CXO Summit, Jane?
It's in September in Cambridge, and then we've got a Clinical Leadership Academy in December, which is for just clinicians and doctors, nurses, AHPs, midwives, pharmacists, they all come. That's a slightly different agenda focused just on clinical digital leadership. But the CXO Summit is always going to be in April and September every year. It's got a cadence of its own now.
We'll put a link to these things in the show notes as well.
Thank you. Thank you.
Jane, thank you so much for coming on the show. We can all benefit from your wealth of experience and knowledge in this space. And again, congratulations to you, Andrew, everyone who listens, who has been involved in FedIP, and indeed the people making the decision in the NHS too. It's great to see. And we will continue to cover these stories as well so that we can showcase your success with these programs globally and encourage other jurisdictions to pursue similar programs. And then we'll eventually have our international passport where I can go anywhere as a digital health professional and be recognised for my skills and knowledge. That would be great. So thank you, Jane.
It would be wonderful. But thank you so much for the chat. It's been great to see you both today. And I hope to see you in person before too long.
Thanks very much, Jane. It's been a real pleasure. And it's really exciting seeing this professionalisation. It's something that I would have loved 30 or 40 years ago when I first started in this field.
Absolutely, absolutely. I think the only way is up at the moment and very exciting times to be working in this profession.
Thank you everyone for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by me, Louise Shaper, with audio engineering by the wonderful Ivan Jurek of Octopod Productions. Big thanks to Emily Mara for all of her support, and most of all, big thanks to you guys. Thanks for everyone out there listening. We have people all around the world that tune into this show, and George and I are so grateful for every single one of you. So make sure you tell a friend, subscribe, follow, rate us when you get a moment, please. It really helps people find us and discover us. And of course, you can visit pulseit.news to catch up on all the news from Australia, New Zealand and Ireland. Send any feedback or topic suggestions to George and I at pulsepod@pulseit.news. We always love to hear from you. Have a great day.